in case you're very addicted to mobile, buy a mobile stand. Don't hold in hands too much time.
But Sumit, the problem here is, like even when I lie down in the night and I see mobile.
Yes.
So that is, I think, totally no.
That is totally bad.
I've been seeing lot of reels saying sleeping on one side is bad, sleeping on your tummy is bad, sleeping in a particular posture is bad. Is it so?
See, sleeping on sideways is the best position, but sleeping on the stomach is not mostly advisable because you are not able to breathe proper.
Other common problem I see in the elderly is something constipation, the bowel movements. So do you suggest there certain posture will it help with the bowel movements?
Definitely.
Now similarly in women, what we see is they have as they age, especially after the pregnancy and all that, urinary incontinence. In the
Yes.
sense urge, suddenly they cough or they laugh, they wet their panty.
Yes.
So are there any exercises for this?
Yes, they required. It depends how severe they're.
Hello, friends. Welcome back to our podcast channel, Nothing But Truth. Today, I welcome Dr. Sumit Gupta, who is going to talk something about geriatric postures or geriatric physiotherapy. Let's hear from him what one needs as one gets older. Hello, Sumit. Welcome to my show.
Thanks for inviting me again. Okay, it's pleasure to come here
Thank
again.
you. So, Sumit, today we thought, as we see geriatric, like especially in India, the people who are above 60, 65, we have a significant population.
Yes.
But not everybody has been a good health. So I'm not here. We are not discussing about the medical health, like the diabetes, thyroid, kidney. But today we thought how a physiotherapist, with your skill, how can you help this little elderly people to live a more mobile life? Is there a role for you in it?
Definitely. Okay, there is a lot of role, and it's a very crucial role.
Right,
Okay,
right.
in geriatric health.
Right.
Because see, when you are old,
Right.
you decrease in muscle mass.
Right.
You have flexibility reduced. You have lot of degenerative changes. Okay, you have prone to falls. Okay, so how this can be prevented and treated? Who will
Correct.
treat? Okay, the older age people at home, they will be not knowing what to do and how to treat with this, how to deal with this. Okay, so their physiotherapy roles, how? Okay, with falls prevention training called functional training.
Okay.
Okay. Then muscle training. Okay, plus the balance training. Okay, which helps them to maintain. Again, it comes posture. Okay, which I told in my last podcast channel.
Right.
Okay, so same posture is very important in this also.
Right.
Okay, so posture means in older age you have more weaker muscles compared to young age, definitely.
Yes.
So there comes muscle strengthening of the core, legs, and the hip to maintain the balance. Okay, and the falls prevention means it's a functional training. Okay, what activities they are facing more difficulties in deal while walking, sitting to standing, sleeping to getting up. Okay, what facing most difficulty, we have to design their exercise system based on that.
No, very. Now you introduced two new terms to me also. One is fall prevention.
Yes.
I didn't know there's something called fall prevention, but in that age group, I think is the most important.
Most important.
Right? People fall and they
Yes, leads to
sometimes have
fractures.
very fatal injuries.
Yes.
Then second thing you told me, what I feel is very new and important is balance.
Yes.
Right? Why do people fall? Because of imbalance.
Balance.
Now, so if I'm going to discuss more in detail with you, balance, when we say balance. Now, what are the balance? Like you just mentioned, from sitting, lying down to sitting to getting up. In my own practice, I have seen a lot of elderly people, when they got up from sitting, they fell off.
Yes.
They didn't get a balance. And they find it very, very difficult to accept it because they have been active. Right? So this suddenly losing balance, suddenly falling, things slipping out of their hand. So what is this balance? What do we mean by balance and how can you help one?
See, balance means when you stand. Again, how your base of sport, how the center of gravity falling in that. Okay, that is your balance.
Right.
How to develop that? There are different. You have to develop the balance. Okay, mostly in unstable surface to get to balance in normal.
Okay.
Okay, so you require, it's like suppose, okay, when you're sitting to standing, okay, so I'll tell them sit to stand with little closed eyes.
Close eyes.
Okay,
Okay. Okay.
definitely we are taking care, we are standing near to that.
Yeah,
Okay,
you're there.
yeah, you're
Yeah.
there. Okay, so that type of training, proprioception works. Your body.
Proprioception works.
Because the nervous system involves in the
Right.
balance. Okay,
Right.
so plus muscle strengthening has to be there. Without
Correct.
muscle strengthening, you can't
Correct.
develop balance
Correct.
also. Okay,
Correct.
so how the balance? It through proprioception. So through proprioception means, okay, when you're closing your eyes, how you're understanding awareness of the body.
Correct. So visual input is not
Yes,
there.
yes.
When you close the eye, visual is not there.
Okay. So it is like how your body has to be in the environment, okay, in the air, in the gravity, okay, when you are not able to cope up with your proprioception, okay, senses proper.
Right. So you will help them understand and train them in
Yes,
that.
train them. It is lot of trainings. It is
Correct.
like, it depends on
Correct.
what stage they are.
Correct.
Okay. If they are very, okay, mostly very bad stage in balance, then we have to start from the bed also. Okay.
Okay.
It is not only we have to start the unstable surface
Correct.
directly.
Correct.
You can't. Okay.
Correct.
With this type of people. Then we start functional training with balance combined for them.
Correct.
Okay. So like stair climbing. Okay. How to do have stair climbing. Even more of chances stair climbing they will fall. Okay,
Right,
because they lose balance mostly in that.
Correct.
Okay, sitting to standing they lose balance. Okay, so how to maintain that balance, how to train that balance, physiotherapy role is there.
Very
Definitely.
I think very true. What even me, my parents are with me. They are like around 75, 70. My father keeps falling every second day. He's active, mobile. You know, when he goes out to buy some milk or something, like day before also, he fell down. So I have been thinking it is his haste.
Yes.
It's not.
It's not.
He has a problem due to his old
Old
age.
age.
I think I should get it to
Yes,
get it
definitely.
to you.
See, you have to check it is causing by some medical first.
Yes.
Clear it up.
Correct.
If it is not causing medical, definitely, okay, he can develop.
Correct.
Okay.
So this is about balance. Now you said about fall prevention. So I would like to know, like even the people would like to know, what are the basic thing? All of us have elderly people in our house, our
Yes.
parents, in-laws, whatever. So how do I make the environment safe? Or how do I prevent these falls? Like I was telling, my father keeps falling. So what do you? I know you're not seeing my father now, but what are the basic general criteria one can do in their house to prevent this fall?
First, little bit adjustments for them.
Right.
Okay.
Right.
Okay. Environment adjustments. How is the place when where he is walking daily basis? How is the, and plus assistive aids. Okay.
Right.
If you feel okay till the time they are not developing that physically strength, okay, and the balance, you can give them assistive aids more,
Right.
like a stick
Right.
to walk them. Okay, and along with that, gait training, how to walk with that.
Gait training is just not enough.
It's not, yes,
Yeah.
because you should know how you have to keep your leg, how far you have to keep your leg with the stick, along with the stick,
Right.
and which leg you have to keep first.
Right.
Okay, that type of training that comes under falls prevention training
Right.
at home.
At home.
At physiotherapy centers, if they're coming, we have to start strengthening their muscles. We have to start training their balance. We have to start flexibility increased. All that, because this only leads to reduce their pace of sport mostly.
So what I understand now again, the most important comes down to your muscle strength
Yes,
and your mobility.
Mobility.
Right? Joint mobility. So I think we realize its importance as we get older.
yes.
Younger days we are just, our bodies compensating.
Compensating everything.
But as we get older, body is not able to compensate. So I think there is a big role, especially in big societies when there are more lot of, like in my society is a 2,000 apartments. So we have a lot of elderly people. But I see these people normally just sit on a bench
Yes,
and chit chat.
yes.
I think they need this somebody who can come there, take like a class, do some mobility
Yes.
and some muscle strengthening which is okay for their age.
Definitely.
It's
It
not
has
about
to
hitting
design.
Yes, it has to be
It can't
designed.
be okay, just what is pattern for
Correct.
everyone. It has to
Exactly.
design again on the individual.
Correct. So
Okay.
what is right for me may not be right for my
Yes.
father.
Yes.
That's what you're saying. It has to be a
Yes.
individualized program.
Design. Yes.
But there's a huge need for that.
Definitely, because okay, if you see okay the abroad, okay, the older age group, they are very active.
Correct. That's what.
Okay,
Yeah.
because even the younger age active, that's why they are maintaining now in older age. But here it's mostly maximum they go for just near friends walking,
Correct.
talking in the box.
And we're just
That's
only busy about our career and all that.
yes.
This is a very good thing you said. Like yesterday itself, I had a patient who was 90-year-old. Wife is 75-year-old. They had come last year for a surgery to me, and they have just come for a follow up. So they have come all the way from US, and only two of them. They're very mobile. They're managing all the thing. But the same thing that age in Indian setup, what I see is they're just sitting.
Yes.
So I think there's a
It's a
huge.
huge. That's why you will see even patients which I see in Indian populations, even if they after some injuries or recovering will be slow with them.
Correct.
Because their body is not used to any kind of exercise. Their
Correct.
muscle wastings are too much.
They have not spent any time on them.
Yes.
They have not done. That's a
They are not taken care of their health.
Correct. So it's a very very important concept called muscle wasting. I have seen in my own father, his muscles I feel are all wasted. It's not about the weight, it's not about the age, it's about your muscle. So at the right age, like even I have missed it. I should have started, though it's a little difficult, he will not hear to me, but muscle strengthening, muscle training, mobility exercise, the important for an older age group. Now, having said this, other common problem I see in the elderly, not only in my house, my patient and others, family, is something constipation, the bowel movements. So, as a physiotherapist, I know you deal with everything. So, do you suggest there are certain posture or certain things if they do, will it help with the bowel movements?
Definitely. If they do the okay spine exercises,
Spine exercises, okay.
especially the lumbar exercises,
Right.
and the pelvic floor education exercises, that helps them to control their okay muscles in that area, okay, along with the nervous stimulation.
Right.
Okay, so that is very important. Okay, topic constipation is a very big topic also.
Right.
Okay, but in older age, simple exercises they can learn, just practice at home. Okay, just 2 3 exercises. We can't give old age too many exercises.
Right.
Also.
Obviously, it's not possible.
Impossible. So 2 3 very important spine exercises and plus pelvic floor exercise helps them to relieve constipations.
Can you tell me few what, like you said, 2 3? So what specifically are you trying to tell?
Specifically, it's like knee to chest
Knee to chest, right?
exercises. Okay, rotation of the spine.
Right.
Exercises. Then, if you heard yoga, people heard about okay Bhujangasana.
Bhujangasana, okay.
That help these type of exercise helps okay in the pelvic floor muscles relaxation.
Correct.
Okay,
Bowel
so definitely
movements will be
bowel
correct.
movements will be smoother.
Correct. Now, similarly in women, what we see is they have as they age, especially after the pregnancy and all that, it's a very common thing. They have this urinary incontinence, in the
Yes.
sense urge. Suddenly they cough or they laugh, they wet their panties.
Yes.
So, are there any exercises for this?
Yes, they required. It depends how severe their
Right.
okay pelvic floor is getting weaker.
Right.
If they're very weak, they
Right.
required definitely in house. Okay, with the
Correct.
physiotherapist.
Correct.
Like okay, with the use of biofeedback, with the
Bio-
use of TENS machine, along with that pelvic floor training.
Okay.
Okay, but if they're okay milder stage,
Correct.
then they can just okay pelvic floor exercise. It's called Kegel exercise.
Kegel exercise.
Okay,
Right.
it's a simple but Kegel exercise. There are different ways to do.
Right.
Okay, for the beginners, for the advanced people, how weak they are based on that. Kegel exercise is very important. I suggest for all the women has to do. Even the back pain, which I deal with, most of the
Correct.
patients with back pain,
Correct.
their pelvic floor is only creating their back pains. So
Oh,
I will
okay.
start giving them Kegel exercise, and they are already taking treatments long. Okay,
Correct.
but their back pains are not going.
Yeah, so this point, what you said, like Kegel exercise, even I advise for my plastic surgery patient for different reasons. But what you said, this point, like bad pelvic floor can cause back pain.
Yes.
That we are not aware. We are always focusing about low back.
Yes.
There's some issue with the spine. People normally think. So a poor pelvic floor can also cause low back.
It has researched lot in female, specifically in female population. Okay,
Correct.
pelvic floor weakness leads to back pain in 75% patients.
So this is one area where women are missing.
Yes,
They're not giving enough importance.
Enough importance.
Right? So they feel, oh, it's just inconvenient when they cough, when they
Yes.
laugh. Lot of women I know personally also.
What I will tell, even okay, my family is,
Correct.
because it's a family, so they won't understand okay, that much. I'll tell them why you are getting this.
Correct.
Okay, they think we are suffering from this longer.
Exactly. It's a normal
It's a
thing.
normal thing.
Yeah.
Okay,
It's aging.
But, yes, but they don't know why they're.
Correct.
Okay,
And
what
that
is,
it can be corrected.
yes, they think okay, now what is the use of corrections, okay, all that. I told it helps for you to maintain still lot of
Yes.
things.
You need a decent, right?
Yes.
So you need to have a control.
Yes.
That is true. Now, other thing I see in elderly as we age is shoulder. So earlier I was not very aware, but since my husband is an orthopedic surgeon, I've been seeing, he discussing a lot of shoulder issue, especially this frozen shoulder. So is it common in the more in the elderly, the more
Yes,
senior citizens?
definitely. Okay, see, in older age population, okay, degeneration,
Right,
okay,
right,
muscle wasting is too much. Okay,
Correct.
so because of too much this degeneration and muscle wasting, they become immobile, the joints more.
Right.
When you become immobile, your joints, it become frost. Okay, so it can be in old age or it can be due to medical conditions
Correct.
also, like diabetes, thyroid.
Correct.
This all can cause
Correct.
that. Okay,
Correct.
but how to deal with this? If they are maintaining their mobility, it is very less chance they will get the frozen shoulder case. Okay, problems. Okay, so the people, at least I am telling them, okay, just do this pendulum exercise.
Yes.
Keep doing daily basis this pendulum. It is no harm to do.
Correct.
Just
But they
just to
don't
maintain the
realize.
joint mobility in older age, simple exercise can avoid frozen shoulder.
No, this is true. I've seen a lot of it starts like that, right? When we are walking, as we develop a problem in our shoulder, we stop the pendulum,
Yes.
but we don't give it importance. Then slowly we are not able to, find it difficult to comb.
No, they should check. Okay, it is causing by limiting the joint movement or something else is there.
Correct.
Okay, if it is causing by something else damages, then definitely you're not
Correct.
allowed to
Then
do.
correct.
But it is causing by limiting the joint movement, then it is better to do.
So basically, if it is not due to any other problem, like a injury or a cuff tear or whatever, basically taking care of mobility of the
Yes.
joint will prevent the frozen shoulder.
It prevents a lot of things. It prevents even your chronic arthritis like type of pains
Correct.
in the
Correct.
joints. Okay,
Correct.
not only frozen shoulder. It mostly you will see the cervical spondylosis in old age,
Yes.
lumbar spondylosis in old age.
Yes.
This is what? It's just a limitation of the movements in the joints. Okay, so when you are maintaining the mobility of the joints, you will not prone to these things more.
So easily we blame it on our age.
Yes.
We say, no, I'm getting old. That's why all this. It's not that, right?
Yes.
It's basically we are not taking,
Care
not
of the body.
bothering about our mobility.
Yes.
We have taken things for granted. And when the old age, no more the body can compensate.
Yes.
And that is when we suffer.
Yes.
Now, what are the now other commonest thing? I think even you will agree. You must be getting patient with a lot of knee pain,
Yes.
especially in the elderly again.
Hmm.
So it is obviously all of us, even the normal people, are due to arthritis.
Yes.
Now people are very scared of surgery.
Yes. Definitely.
The moment somebody tells them for a knee replacement, they get really scared. So can physiotherapy in early stages at least help these people?
Definitely, okay. Even if it is not in early stages, even in the middle stages of
Right,
arthritis,
right.
it can help at least to slow down the process.
Correct.
Okay. Might be you required, okay, if you're not taking care, you required surgery in 1 year. It can slow down in 5 years.
That's a big
Okay,
thing,
that's
right?
a big
Yes,
thing.
yeah.
Okay. So, means early stages, definitely, it can cure at least 80%.
Right.
Okay. Middle stages, it can control and slow down the process.
So now, so you got one patient who has an arthritis, knee issue. They come to you and they say, Sumit, I don't want surgery.
Surgery.
So what kind of treatment do you start with and what are your advice that they can do at home?
See, mostly I will start with first, because muscle wasting will be there in
Right.
old age.
Correct.
So I will start first electrotherapy called stimulation machine.
Stimulation. Okay.
Okay, so that the pumping of the muscles and contractions of the muscles will be more faster and good.
Okay.
Okay, along with that, we'll start strengthening there. Okay, the knee muscles.
Right.
Okay, along with the hip muscles, along with the ankle muscles.
So it's not only knee.
No, it is not only, because
So
it's a
that-
weight bearing
yes,
joint.
Yes.
Okay, so it works along with the hip and knee.
So they have equivalent role.
Yes.
Right, you will assess them from the hip,
Yes.
the lower back, everything.
Yes.
And so you are going to strengthen those
Strengthen those muscles.
muscles. So that's the only way. It's not
That's the
like
only way. No.
now. Suppose your patient arthritis, they have a lot of pain. Is walking still advised for them, or they should become immobile?
No, it is not immobile totally. We'll advise them. Okay, it depends on which side they have, lateral side or middle side
Right.
they have arthritis.
Right.
Brace will, in case people are used to, some people are very used to, addicted to walking, like.
Correct.
Okay,
Exactly.
they tell we don't want to
Correct.
stop walking.
Correct.
So we'll advise them to wear brace so that load will not be too much, okay, on the cartilages, so that damages will not happen, worsening like stages. Okay, along with that, we have to maintain the exercise system.
Correct.
Okay.
So it is possible for them to walk.
Yes, with the brace, definitely.
Correct,
There are
because-
these days there are lot of research has done, different types of braces has come, which unload your joint while
Okay.
walking. Okay?
Okay.
So that type of brace also available these days.
Yeah, so that is a big relief, because
Yes.
otherwise what happens is the moment we have pain, elderly, if they become immobile, their life kind of stops,
Yes.
because they have all of the medical issues, the heart, the diabetes, and all that. So this is a very important point, that if they meet the proper specialist, the specialist will be able to help them with accordingly.
Yes.
Whether it's surgery, means surgery. If it is non-surgical, but they have a lot of option non-surgical.
Yes.
Isn't it? So even a brace.
Yes.
So this thing we don't know.
But problem is with the people, if I'll tell them wear brace, okay, they will stop exercise because they will think their pain is gone.
Exactly.
Okay.
Yeah.
But that is maintaining temporary. That is just to
That's not
support.
a solution.
That is not a solution.
It's not a
Solution
cure.
is, yes. That is a support. That is not a treatment and solution for the problem. Solution is only exercise and maintaining range of motion and strength.
Yes, so that is a very, very good point here Sumit has told. Brace can help you in that difficult time, in the pain time, but that is not the treatment or the cure. So you will have to, along with it, do the exercises, the muscle strengthening, whatever has been advised by your therapist. So don't feel happy, okay, my pain is gone, and stop at it. If you really want long term improvement, you will have to continue with the rest of the treatment. Is that true?
Yes.
So, what are the other common things you think you're seeing in a senior citizen? What are the other problems you're seeing as a physiotherapist?
Mostly I have seen their posture. Okay.
True.
Their mobility issue.
Right.
And their stability issue.
Right.
These are the commonest issue you will see in old age.
Right.
Okay, population. And the issue is looks very big, but the solution is very small.
Okay. So it
Okay.
is simple solution.
It is
you're
simple
trying to say.
solution.
It's not very complicated.
It is not very complicated. Okay. But they are not ready to meet any specialist. That's the
Yes.
problem. Okay. They think it is normal aging process.
Yes. It is very much in our upbringing also. We'll age. It
Yes,
happens.
Yes.
But do you think aging now, like my great grandfather and my grandfather also, he lived up to I think 95. So healthy he was. You know, he would just, even he would travel at 1995 alone in a train. He will even go to the upper berth and, jump out of the train, everything. But the same thing, my father is little more lesser. So is it, how is this aging changing over the generation?
It is what I believe and what I have studied. It is mostly two reasons. One, that generation people are very active people.
I think by default,
Yes.
their day-to-day life,
Yes.
they were working.
They were working.
It was not a desk job.
Desk job.
Right.
Sedentary lifestyle was not there.
Correct.
Eating habits was good. Now these days junk food. Even the old age people are eating junk
Yeah,
food.
yeah.
It is not only the young population.
Correct.
Okay. So that type of things, when you are not too much active, definitely it hampers with the age process. Okay.
So it is all about how mobile and active
Yes.
you were in your younger age.
Yes.
Now, other thing, why I'm saying, because because my parents, my in-laws, and all what I'm seeing. My father, most of the time he's on mobile, bored. They feel what else to do. Now, constantly he complains of his thumb pain. That one way the technology has become a curse.
Yes.
Because Wi-Fi is available on mobile, so he is from Haryana, he'll be seeing all the Haryanvi thing, but constant. and the neck pain. So this posture is not only for the youngsters, in the elderly also,
Definitely.
right? So what do you think is the ideal way, if like we cannot stop them from seeing a mobile, we cannot stop ourselves also, we also are quite a bit on our mobiles. So what do you think is the right posture to, or the right way to hold a mobile and watch it?
I will tell them, in case you are very addicted to mobile, okay, buy a mobile stand.
Okay,
Okay, don't hold in hands too much.
correct.
Okay, don't, because if you're keeps, okay, text something, typing or something, straining, holding like this for longer period of time, that means my whole chain of the muscles will get disturbed.
Not only fingers,
Not only
not only
fingers.
wrist.
Okay, this might be a referred problem, it is happening
Correct,
here.
correct.
Okay, the problem is might be causing by the neck only.
Neck is,
Okay,
yes.
so that I will suggest them, in case you're not addicted, okay, too much, okay, watch in TV. Same thing, these just options are there. You can
Correct,
transfer to TV and
correct,
watch it.
correct.
You still want to watch in mobile only? Buy the, okay, mobile stand and watch. Don't hold for longer period of
But
time.
Sumit, the problem here is, even all of us, we want to lie down, right?
Hmm.
At night.
Yes.
Like even I, when I lie down in the night and I see mobile.
Yes.
So that is, I think, totally no.
Totally, that is totally bad.
No, right? It's,
Yes.
yeah, we cannot lie.
Especially switch off the lights, okay,
Correct,
and then watching mobiles, that have lot of, okay, physical health issues also. It is not only, you have other medical issues also will come because of,
correct,
okay, these things.
correct. So that is a
That
total
is
no.
not advisable.
Totally no. If you
Yes.
have to watch your mobile, you're saying get a stand,
Yes.
keep at little distance, and don't hold it in your hand.
Yes.
That is
Yes.
the
Best way.
best way to handle, still use mobile and not get really hampered. Okay, that's so I need to stop that first. Okay, now coming to, like, the sleeping. Like some people sleep with two pillows.
Mm.
Like my husband, Ayyappan, he sleeps with two pillows. He always has neck pain. I also like to sleep with one pillow. My father likes a hard pillow. So what kind of neck pillow should we use? So everybody in my house are using different kind of a pillows.
Pillows.
So let me ask you, should we use a pillow at all?
See, it's all, okay. There is no kind of pillow, okay, for everyone, like one pillow for
Correct,
everyone,
correct,
okay, because it's all, how's your neck position when you're sleeping.
correct.
Okay, if you're using thick pillow, that means the neck is bending too much. If you're using thin pillow with soft, it is going, the neck position is like this.
Right,
Okay,
right.
so it all matters, what pillow is giving you comfort, or without pillow is giving you. Even the branded people have very branded type pillows,
Correct.
still they are getting pains.
Exactly. That's
Okay,
what.
so they bought it to relief, but they are not getting relief.
Correct.
Okay, that means their neck position is still same. What is causing that strain? So it about, okay, what is causing that strain?
No, suppose I'm a person who sleeps completely, suppose, straight. So is there a gap there should be between the pillow and my neck? What is ideal?
I suggest then, okay, if the people are used to pillows, I suggest just keep a towel roll inside your pillow cover.
Okay.
Okay, because this area, the cervical lordosis has to maintain. That's the main thing. So when you're keeping the towel roll, okay, this lordosis will maintain. Then doesn't matter your pillow is big or thick, okay, thin or
So
okay,
lordosis has to be maintained.
maintain.
So it's not like, people say giving support. It's not about
No, no, it
support.
is not about support. Some people are too much like this. Okay, so when they're keeping okay, even the towel roll, that is also not helping them.
Correct.
Okay, because their pillow they are using too, along with their trying to towel roll, that is creating more than pressure. Then
So the
shape.
lordosis has to be maintained.
Yes.
So if I'm sleeping to one side,
Yes.
whichever side, still the lordosis has to be maintained.
Yes. So that means the neck angle has to maintain. It should not go to more lateral flexion like side flexion side. It should not, if you're sleeping this side, it should not go more. This neutrality has to maintain.
Neutrality of the angle has
Has
to
to
be
maintain.
maintained. So whether you do with small pillow, no pillow.
I see mostly I, okay, take, okay, sometimes one pillow was there, okay, that is very old one, but now that is gone. But other pillow is not suiting me now. Okay, whichever I'm buying, it's not suiting me. So I just use towel roll and sleep.
Okay.
No pillows at all, because that is helping me.
So then people who are used to putting 2, 3 pillows, they sleep very inclined. That's really bad.
That is definitely bad because you are going to get the hunchback in later stages of time.
Yeah, so that is totally
That is not advisable.
So when you lie down, you have to be mindful of your posture again.
Yes,
What
definitely.
angle, inclination,
That's why I told
everything.
posture is what? How you sleep, how you walk, how you stand, how you sit, everything.
Now coming to this, sir, I've been seeing lot of reels saying sleeping on one side is bad, sleeping on your tummy is bad, sleeping in a particular posture is bad. Is it so?
See, sleeping on sideways is the best position. Okay. Why? Your all systemic, okay, internal organs is relaxed. Your breathing, okay,
Right.
difficulties are not developing. Your muscle tensions is less. Okay. That's the reason they said sleeping on the side is best. But sleeping on the stomach is not okay, mostly advisable because you are not able to breathe proper. Okay, whole night. Your back load is increasing too much when you're sleeping on the
Your
stomach
backload increases.
is
Okay.
increasing. Even I suggest when the patient is sleeping straight, facing up, keep the pillow below the knees.
Keep the pillow below the knees.
Below the knees.
Okay.
So that your spine is not getting still overload.
So even if you're sleeping straight,
Yes.
that's supine, what you're
Yes.
saying, with your face up.
Right.
In that also you have overloading.
Yes, definitely. Because whole night I am stretching the legs.
Right. So that's
Okay.
also not good.
Not good.
So,
So again, in that, the shape of the spine is going flat too much. I told you lordosis.
correct.
Okay, neck and the back has lordosis. That means the alignment have some that angle. That angle you have to maintain. Either you use some other things to maintain that. If you're not getting comfortable, either you adjust. It depends.
So I think what I learned, to sum it up from this particular podcast, would be your mobility, your posture, your muscle strength is the most important thing. Whether you're sitting, whether you're lying, whether you're sleeping, whether you're walking, and whatever age it may be.
Yes.
Whether you're young, old, teen, doesn't matter.
Doesn't matter.
This is the pillar of your physical strength.
Strength.
That at every cost we need to maintain if you want to live a
Healthier life.
healthy life.
Yes.
Now, sometimes we can't do it ourselves, we can't understand because not enough importance has been given from our childhood.
Yes.
So, then at least we should take a help of a therapist, right? There's no harm. Actually, you're going to benefit, I think, million times more than the small amount one spends on that.
Yes.
But it is a must.
It is must. I suggest, okay, when you're coming to physiotherapist, come for a preventive way compared to going
Yes.
for treatment way.
Exactly.
Okay.
So, don't let things go so bad
Yes.
that all the damages occur and then you're expecting a miracle.
Yes. That's
You know?
true.
To better at every phase, try to correct it
Correct.
before it causes the damage.
Damages.
That's the best way to go for it.
Yes.
So we are going to sign off from this podcast with this last few thoughts. Importance of, again, posture, mobility, and muscle strength. If you would like to know anything more regarding this topic or anything related to physiotherapy, Sumit would be more than happy to answer them. Thank you so much, Sumit, for being here.
Thank you very much.